Gurmaigat Cahirla, I would like to acknowledge the Minister in the House this evening, and I want to firstly acknowledge all the ministers working in the Department of Health at the moment and their officials in dealing with all the ongoing challenges, and certainly the work that is needed is not just acknowledged by me in this House, but by the public as well. So I would like to acknowledge that at the outset. And I'm also conscious of the fact that language being used this evening in terms of contact tracing, that there is a feeling of being overwhelmed by the magnitude of the task, by the magnitude and scale of the challenges as well. So I'm conscious of that. I put down this question, Cahirla, on the back of difficulties expressed to me on yesterday morning by some school principals over the last weekend, and the reason why they contacted me was that there were communication difficulties in dealing with cases that would have been alerted to them on a Friday evening and then going through the process over the weekend. So I think the issue could be summed up in a nutshell by saying its communication, its point of contact, its direction and its protocol for contact tracing. So since putting down this question yesterday, I'm delighted to see that there's been considerable progress made over the last day, and I'm also aware that the primary stakeholders and the secondary stakeholders met with NAFID today as well, and that is really, really necessary to instil confidence in the leadership within the school communities, because we all know and we all appreciate and we all certainly know the value of children and teenagers being back in the school system. Teachers have been very closely monitoring their progress since they've come back. Parents have noticed progression where regression happened when they were absent from school for up to about 6 months, and it's important that we hold on to that progress. So to summarise, Minister, what I'm raising here tonight is something that's already been enacted by the people concerned. I'm very well aware of the demands on the system and the contact tracing system, but it's really, really important and incumbent on all of us to ensure that whatever resources, whatever strengthening of the existing system that can be done should be done. And I know that focus, especially with the participation of NAFID officials at the stakeholders meeting, was a positive step forward today. In conclusion, I want to acknowledge the role played by the officials within the Department of Education. I know they've been liaising quite closely with Department of Health officials now for a long period of time, going back to last March, and there is a constant communication and also a constant engagement in ensuring that they try to get things right. I know different officials from my own communication with them and I suppose relationship with them in my previous role, that they work morning, noon and night to try to get this thing, this challenge under control. But just to conclude again, Minister, we're all on the same hymn sheet, whether it's parents, whether it's teachers, whether it's principals, to ensure that the progress that have been made in having children and teenagers back in school, that stays on track to ensure that we continue with the primary motivation of educating our young people. Thanks, Minister.
And thank you, Deputy McHugh, for actually putting down this question and giving an opportunity for us to clarify it here on the floor. As you say, communication is key on this, and it's key for the principals, it's key for the parents, and most importantly for the continuity of children attending schools. So I'm going to read out the script as it was prepared for me, because I think the clarification points are very important. But before I begin, it is important to say all officials in both departments are working tirelessly together to ensure that anything that needs to be done is being done to ensure education can continue. So I am happy to have this opportunity to outline the protocols and supports in place for schools and briefly describe the overarching public health principles, including case investigations and risk assessment, that govern the response to cases and outbreaks of COVID-19 are consistently applied across all school settings. In all schools with a suspected case of COVID-19, HSE Public Health will undertake a risk assessment assessment in order to assess the unique risks in each situation and decide on appropriate, proportionate action to protect the health of students, staff and the wider community. It is important to note that these actions will vary in different schools. This is because every school is unique, with unique risks in relation to the spread of COVID. So different measures are required to manage outbreaks in different schools. This is entirely appropriate and is co-tenant of public health management of outbreaks of notable infectious disease, including COVID-19. The public health risk assessment approach is described in the school's pathway for COVID-19, the public health approach, available on the back of school webpage. Risk assessment is carried out under the jurisdiction of the public health doctor at the relevant regional HSE department of public health. Public health doctors are expert in risk assessment. As previously outlined, but because every school setting is unique, the risk of COVID transmission will vary on a case-by-case basis. The risk assessment process for each outbreak in a school setting assesses a variety of context-specific factors to determine appropriate and proportionate measures to be taken to protect the children, the staff in the school, and to prevent onward transmission to protect public health. For example, if a confirmed case of COVID-19 with links to a school is identified, HSE Public Health will undertake case investigation to determine whether they have been in the school during the infectious period. If they have been in the school during the infectious period, the HSE Public Health will undertake contact tracing and risk assessment. This may result in a whole pod or class being excluded and tested for COVID-19 if they are deemed to be a close contact. When public health departments are formally informed of a COVID-19 who attended an educational facility whilst infectious, they are then undertake a PHRA. This usually happens the same day or the following day. There have been a delay in a particular region which the HSE is working to address urgently. The Public Health Medical Service is available 7 days a week and contact with school is made on that basis. The risk assessment is dynamic, evolving as more information becomes available. And for example, if contact tracing identifies additional confirmed cases that are widespread throughout the school, the HSE Public Health suspect transmission in the school setting, this may contribute to a decision to partially or fully close a facility as an outbreak control measure. However, if following a case investigation or risk assessment, it is determined that there is no risk of transmission in the school setting, the HSE Public Health may advise that further testing in the school is not required.
Gormaigad, Cahirlagus Gormaigad, Tahara Foste. Look, I think that's a comprehensive answer, and I think it's good to see the response also including an upfront honesty around where challenges exist, and in one particular area the department and HSE is working to deal with issues that are ongoing there. So it's important that we continue to be transparent. Information is key. The re-emphasising of 7 days a week availability is really important to these principals in the days ahead, because one thing to re-emphasise again is for sure the feeling and intensity of feeling amongst principals and amongst teachers, primary and secondary, as you know yourself, Minister, is that they want to continue teaching, they see the progress and they want to ensure to be in a position to lead on the education front, but also taking a responsible position as well to lead on the health and safety front as well. So it's a dual responsibility that they have. But I think following the meeting today and also in the comprehensive nature of this answer, that hopefully will make progress. Can I just conclude by saying this, Cahirla? Many people have different opinions and varied opinions on what happened last night. As the evenings get shorter, it's a different lockdown, it's a different period of time. The lockdown in March, the sun was in the sky, the evenings were longer. With a lockdown coming now, the evenings are getting shorter. And can I just make one point around the 5 kilometre rule? A lot of people, not just elderly, a lot of people go for walks in the evening, and if you're living in rural Ireland, you could be living 10 miles from lights, from a town, from a village, and I just think we have to have due consideration for people who want to walk on a footpath in a safe area, because we don't want people endangering their lives, putting their safety in jeopardy, and it's just one area where we need to have closer scrutiny. Finally, and I know we've got 1 second left, but just one final point. A lot of conversation going on about the GAA. The GAA were here in the darkest of days, when this country was in the most difficult of times. They always were, and they were there for the school meals programme and the voluntary level, when they were handing out school meals, when I was in my previous role, and certainly when the evenings are short, when there's people in their houses, they have something to look forward to, and whether it's inter-county football, inter-county hurling or inter-county camogie, it's something that we should work hard, because it's not a glamorous job for those GAA athletes. They're not getting on buses, it's not glamorous, they're getting changed at home, they're training, they're going in their own car, their own vehicles, and it's a difficult time for them too, but they are providing a ray of hope for so many people in this country.
And thank you very much again, Deputy McHugh. And actually, I'll only take a minute to respond, so as we keep on track with the time tonight. And I couldn't agree more with everything you have said. And language is also important. You've covered everything there, but how we communicate to people at the moment and how we use our language, and not to be over-alarming, is also important, because young people, there's a lot of anxiety, there's a lot of stress out there. There's stress on the pressure on the principals, on the teaching staff, on the parents and on the young people. And most importantly, we need to be calm and measured in our approach and our response and in our asks. And I think that's what you've articulated here tonight. I just want to lay on the record one important piece of information, and this is to do with the contact and tracing. And a process is currently in operation to support on all ongoing school testing. And as of October 13th, 364 schools have had or are having some testing completed as a consequence of public health risk assessment. From the 364 schools that have had mass tests, an additional 172 cases have been detected and identified, and 8,606 students and teachers have been involved in this mass testing. So the testing and tracing system is working, and demands on the system are being met by increased resources being applied by the HSE. And the testing and tracing system is operating 7 days a week from 8 AM to 8 PM. Gora Mahagat.